From the research bench to the patient's bedside, this is Bench to Bedside with your host, Vice Chancellor and Director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Tracy Solis says she may never be the woman she was before her 2019 breast cancer diagnosis, but she is navigating life again. Her treatment, which included surgery, chemotherapy, and 33 rounds of radiation, was successful and she is thriving. However, Tracy still has significant side effects to overcome as a result of her life-saving treatment. Tracy experienced pelvic floor dysfunction, which can cause urinary incontinence, pelvic organ prolapse, sexual dysfunction, fecal incontinence, and pelvic pain. Tracy didn't suffer from all of these symptoms, but her symptoms were unpredictable and uncomfortable to talk about. While physicians say pelvic floor dysfunction is a common side effect of cancer treatment, they agree that it doesn't get talked about enough. Thankfully for Tracy, the University of Kansas Cancer Center's comprehensive program offers treatment for pelvic floor dysfunction by specifically trained physical therapists, one of whom is with us here today. Hi, I'm Dr. Roy Jensen, Vice Chancellor and Director of the Cancer Center. We have 3 guests today to talk about pelvic floor dysfunction and the therapy we offer. Here in the studio is gynecologist and urogynecologist Dr. Melanie Meister with the University of Kansas Health System. And joining us via Zoom are Eileen Coughenour, a health system physical therapist who specializes in pelvic rehabilitation, and breast cancer survivor Tracy Solis, who is treated for pelvic floor dysfunction. Thanks for joining us for today's episode of Bench to Bedside. So Tracy, before we get started, can you tell us where you are right now and what is happening?
Yes, currently I am on the floor CA11, which is the brand new tower, and the 11th floor is oncology. Currently this morning I've been here since 7 a.m. getting an infusion. I get infusions of whatever I may be low on, which right now it's potassium.
So are you comfortable and you're good to go?
Yeah, I'm good to go. I just, I'm used to hanging out with my pump.
Well,
we're BFFs at this point.
Well, thanks so much for joining us. We really appreciate it. Obviously, we didn't quite plan it this way, but we appreciate your willingness to appear on the show and talk about this important issue. Before we get
no problem.
Before we get started specifically on pelvic floor dysfunction, could you tell us a little bit about how the pandemic has impacted your treatments?
Well, the major impact that I get is that I do have to come to treatment alone, and I am in treatment at least 3 days a week. So the biggest one is just coming by myself. I've had to learn to occupy my 3 to 4 hours time frame that I'm here. So
I see. Well, thanks so much for being with us.
Yeah.
So, Dr. Meister, could you tell us what the pelvic floor is, first of all, and what it does, and how does pelvic floor dysfunction occur?
Sure. So when we talk about the pelvic floor, we're specifically referring to the muscles and connective tissue that maintain and support the organs within the bony pelvis. The pelvic floor dysfunction can occur for a variety of reasons, often age, pregnancy, delivery, even menopause. The pelvic floor is involved in everyday physiologic functions like bladder and bowel control, but it's also dynamic and it responds to accommodate sexual intercourse as well as pregnancy and vaginal delivery. Like I said, it can occur as a result of age or menopause. Also, surgery within the pelvis can impact the pelvic floor and lead to pelvic floor dysfunction. And medical conditions and treatments like Tracy experienced can also result in pelvic floor dysfunction.
So, Eileen, what is pelvic floor therapy, and what do we offer patients that are suffering from this issue?
Pelvic health physical therapists are physical therapists who specialize in treatment of the pelvic floor. We focus on challenges related to the pelvic area, as Dr. Meister mentioned, including changes to the bowel habit, bladder habits, pain, and pain with intercourse. Common diagnoses include urinary and fecal incontinence or leakage, constipation or diarrhea, pelvic or abdominal pain, and pain with intercourse. Both men and women have pelvic floors and pelvic health needs, and we treat both here at KU. We offer comprehensive physical therapy assessment and recognize the need to address everything from head to toe. We are one body connected, and so we have to address everything. Sometimes it's all the way from mental health down to what shoes you're wearing and what your toes and feet are doing. We have modalities such as biofeedback and electrical stimulation, and do a lot of manual therapy. So using our hands to provide therapeutic intervention, such as fascia and soft tissue mobilization to the skin, as well as scars. We do manual therapy on radiated tissues and work on the muscles with such things as like a trigger point release. We prescribe therapeutic exercise that is targeted to each person to get their muscles stretched, or, you know, whether they need to be stronger or have more movement, and address their sexual health and function. Between breast cancer or other gynecological cancers, and even without a cancer diagnosis. But the cancer treatments often include chemotherapy, radiation, surgery, medically induced menopause, and all of those can impact the tissues as well as the self-image of the woman. So we look at all of those factors, provide intervention as we can, and sometimes also refer out to other medical specialists or mental health providers to help with the sexual function component as well.
So, Eileen, I suspect that most of our viewers have not heard of this issue. Could you give us a bit of a sense of the scope of this problem among cancer patients? For instance, how many patients a week do you see that you're involved in their treatment for this condition?
We see currently we have 3 therapists. We have a 4th that will be coming on board, and we have more referrals to us than we can handle. And that is a kind of systemic thing of pelvic health therapists in the area. There's a lot of women and men with pelvic health needs. And again, it's oncology related as well as not oncology related. There was something, I don't remember what I was going to say.
So Tracy, what practices, tips, and exercises that you've learned from your therapy sessions have become part of your daily routine, and what do you want other women to know about this condition?
Well, I learned from therapy that I start my day with like a warm drink. It just helps wake up my GI tract. And I've also have changed my diet to foods that are easily digestible. And Eileen has also taught me something very important, which is breathing. And that during transfers, such as standing and rolling, the importance of movement of the pelvic floor muscles. Not just contracting, but having a mind and body connection with the pelvic area. There is not a one-size-fits-all treatment plan. Exercise and movement are good, and you can get customized help from a pelvic PT. I do want other women and men to know that they are not alone. Chemo systematically ravages our bodies, and after, when we start to experience things like urinary incontinence and other taboo subjects that we just live in silence, we just need to know that we can bring this up to our oncology team so they can direct us to the right specialists to address issues that haven't been addressed.
Well, Tracy, we certainly appreciate your willingness to be on the program this morning and discuss these issues. And Eileen, what can patients do to make it easier for them to discuss these issues with their physicians?
I think, as Tracy mentioned, and I kind of mentioned, the knowledge that you are not alone, that there are a lot of other people with similar or the exact same symptoms. So you can bring these up to your provider. You will not be the first one they've heard say, I'm leaking when I cough. I'm leaking doing XYZ. It's painful to have intercourse now. So knowing that you're not alone, and then having that courage to bring it up. I would, in my ideal world, providers and patients would address these, as Tracy said, the taboo topics, and make them common medical conversations.
If you're just joining us, we're here with gynecologist and urogynecologist, Dr. Melanie Meister, pelvic rehabilitation physical therapist, Eileen Coughenour, and breast cancer survivor, Tracy Solis, to talk about pelvic floor dysfunction, a common but not often talked about side effect of cancer treatment. If you have questions, please post them in the comments below, and we have Alexis Del Cid, who is joining us in studio to take those questions, and I think it'd probably be a good time to ask Alexis if we have any questions.
Well, this is so interesting because as doctors, as you've been saying, patients are so reluctant to talk about this. So pretty much every single question I'm getting is in the form of a private message from a woman who doesn't want her name used, which is such a shame because there are so many of you that have similar questions. So, and also hats off to Tracy, who's here getting an infusion, and she's still on the live program. What a rock star. That's so, the energy of Tracy must be astounding. So I want to get to some of the questions that I'm getting. And again, I'm getting these in all different ways. A woman who doesn't want to be named says, what are the symptoms of pelvic floor dysfunction? I turned 40 and I started to have to cross my legs whenever I sneezed. Such a bummer. I can't tell you how many moms will say this, or women, and no one wants to talk about it, but is this something that pelvic floor therapy can help with?
Dr. Meister?
Dr. Meister.
Sure, yeah. So symptoms of pelvic floor dysfunction are variable. I think Eileen hit on a couple of these, but certainly urinary incontinence, or even short of leaking, urinary urgency frequency, that feeling like I have to go all the time, or man, I get the urge and I really have to run to get there. Pelvic pressure, pelvic heaviness, sometimes bowel symptoms like constipation or even leaking stool, all can be symptoms of pelvic floor dysfunction. Pelvic floor physical therapy is definitely something that can help and is often a really great first-line conservative management strategy that doesn't involve a medication or doesn't involve surgery, but it's a great place to start and can really help a lot of women.
So the people who are asking this question, all the women
Absolutely.
who are crossing their legs when they sneeze,
Right.
they could see a pelvic floor therapist and that might help.
Yes, and the thing I would really like to say is that although these symptoms are very common, a lot of women experience them, we don't talk about them very well. Lots of providers don't ask about them. And just because they're common does not make them normal or something that we have to live with. So it's certainly something that we can address and we should address.
I do have a question from Mindy. Mindy wants to know, do you have trouble suggesting pelvic floor therapy because it's so intimate and people are uncomfortable with the idea of it? It is a very intimate form of therapy.
It is an intimate form of therapy, and that's actually how I usually bring it up with patients. I usually say, we use pelvic floor physical therapy a lot. It's very effective. It is a one-on-one interaction with a female physical therapist. I think sort of addressing it or highlighting the fact that it's one-on-one in a private room with another female makes it a little bit more acceptable. I can't tell you how many women I've had go to pelvic floor physical therapy and come back and tell me how much it's changed their life. And I tell patients that as well.
There is someone who has shared a story here about, my doctor prescribed pelvic floor therapy to me and it completely fixed my lower back pain.
Yeah.
Just regular lower back pain is what I'm reading from this. So does that just, you're able to reach muscles from a different angle that you couldn't reach with massage therapy the traditional way?
Yes, and the pelvic floor, I talked about it being the muscles and connective tissue that support the bony pelvis, but our pelvis is really part of our core, and Eileen can talk about this too, but it's involved in everything. Walking, rising from standing to sitting, rolling over in bed, all of those things, we think about them being our core muscles or our back, but the pelvic floor is involved as well, and it often goes unrecognized, but treating the pelvic floor can have a dramatic effect on symptoms that seem unrelated.
I'm getting more questions.
Sure.
If you're okay. Someone wrote, is pelvic floor therapy considered physical therapy or a traditional doctor's appointment? I'm wondering if my insurance will cover it. And I know we have a physical therapist who's joining us. So how do you guys navigate that with insurance?
Eileen, why don't you take that?
Yeah.
Okay. It is billed as the same as a traditional physical therapy appointment. So we are, our billing codes are the same, that we're doing manual therapy, therapeutic exercise. The majority of our sessions are not doing internal assessments. They can be, but we do a lot of talk about posture, breathing. We do a lot of hip and low back range of motion. So like I said, it's a very comprehensive whole body treatment.
Tracy, would you like to weigh in on this issue?
Yeah, I did. It is part of physical therapy. Like Eileen said, it's the same codes and everything was covered for me. And I just wanted to add that, cancer rehabilitation, it's really a journey and it is not linear. Eileen has been with me from the start of this problem, and she's been able to travel with me and address various needs that arise. She has sent me to where I need to go to other specialties that can help me with the problems that have arisen while she's doing what she does. So, I did suffer. That was my big, huge concern, was the urinary incontinence. I just felt like, I'm too young for this. This should not be happening. I shouldn't have to cross my legs every time I laugh or sneeze or cough, or it just got to a point and I didn't understand. And I finally had a big, huge group of support that I had leaned into. And that's actually where I first heard about pelvic floor therapy. And as soon as I knew that KU had them, I called my oncology team and got a referral to pelvic floor therapy. But also GI has sent me to pelvic floor therapy. So there's just so many different areas that you don't realize affect your pelvic floor therapy. And as a patient, I just feel like it needs to be talked about now. There's no reason why we should be embarrassed of what our bodies are doing, and get help for it.
Well, thanks again so much. Alexis, we're getting so many great questions. Could you make sure that you share the link for...
Yes, and hashtag bench to bedside as well. So you can reach us on Facebook at the University of Kansas Cancer Center. You can also send me direct messages to Facebook. So in case it's a touchy subject and you don't want to attach your name and your Facebook profile to it, which is illustrating part of the problem that we're seeing, is that women, they're embarrassed. It's touchy to talk about this stuff, but Chris did share with us, thank you for bringing up issues that are difficult to talk about. I'm so glad this program exists. And then Kathy wrote, thank you, which is really sums it up. Just thank you for bringing this to light. I do have another anonymous question.
Sure.
not anonymous to me, but anonymous for the purposes of putting it across the internet. A woman shared and wants to know, does pelvic floor therapy work for painful intercourse? I'm in menopause and it's no fun anymore. Dr. Meister?
Yeah, so there can be a number of reasons that intercourse can become painful after menopause. Related to pelvic floor muscle dysfunction, certainly, and physical therapy can help with that. There are some other reasons that intercourse can be painful after menopause. Sometimes it's a lubrication issue or because of a change in the tissue, which your doctor or a gynecologist could evaluate for, but certainly pelvic floor therapy can be very helpful.
So, Dr. Meister, as kind of a follow-up to that question, pelvic floor dysfunction can be a side effect of a number of other conditions in addition to cancer treatment. What are some of those situations where pelvic floor dysfunction might occur?
Right. So in addition to cancer and cancer treatment, we see pelvic floor dysfunction in women with neurologic conditions like multiple sclerosis or after a stroke. Some medications can also worsen pelvic floor function. So for example, women taking diuretics or a water pill may notice a worsening of their urinary symptoms or even new onset or worsening incontinence. Other medical conditions like obesity can exacerbate pelvic floor dysfunction and contribute. And then probably most commonly, pregnancy and delivery can lead to pelvic floor dysfunction. And for some women that resolves in the postpartum period, and for other women it persists. So a lot of things can lead to pelvic floor dysfunction.
Sounds like we have yet another question.
This is from Megan. Are there certain types of cancers that affect the pelvic floor specifically? That's a good question. Mm-hmm. So I'm going to direct that. Well, Dr. Jensen, would I direct that to you or Dr. Meister?
I think we'll let Dr. Meister.
Okay.
So we tend to see this more commonly in the gynecologic cancers and breast cancer. Cancers that whose treatment often involves some sort of removal of hormonal stimulation because the pelvic floor is so responsive to hormones like estrogen and progesterone. So patients like Tracy who undergo treatment that might decrease their systemic levels of estrogen, we see most commonly have pelvic floor dysfunction. But really, any cancer treatment, there can be implications for the pelvic floor. Yeah.
Pauline has a question for Eileen. Pauline wants to know breathing, and for Tracy as well. Tracy mentioned breathing exercises to relieve symptoms. What do the breathing exercises involve, and can you walk us through that?
Sure. So breathing, our respiratory diaphragm and our pelvic diaphragm, our abdominal wall and our pelvic floor are all connected. So we use breathing as a way to mobilize the pelvic floor. So one example is if you do a big belly breath in, so when you inhale through your nose and expand your belly real nice and big and try to feel an elongation or opening of the pelvic floor, and then matching that with the opposite. So when you exhale, you gently engage your pelvic floor and your lower abdominal muscles. This can be a very complex thing to learn and can be opposite of what people have been doing for their lifetime. So I equate it to, it might feel like you're learning a new complicated dance move and it takes a lot of brain power. This can be a good thing that you practice and say, can I even feel my pelvic floor moving? And if you're not able to really get that brain-body connection, then that by itself could be something that we work on, is just saying, can you coordinate these muscles? Can they do what you tell them to do? Can you find them? But back to the breathing. So expand everything when you breathe in and do a gentle contraction when you exhale.
Tracy, it sounded like you wanted to weigh in on this question. Am I right?
Actually, when she taught me to do all this, I was getting ready to do my lat flap surgery, my first reconstruction. And the way, like, I had to learn how to basically sit down and stand up. I know that sounds so easy to do, but you actually forget to breathe. So like you have to make sure that you're breathing while you're doing the sit up, sit down, because those are the muscles that you're going to be activating a lot, because you know your pain's going to be all in your back and your side. So the breathing came in at the right time, and Eileen got me through so much.
Alexis, sounds like we have another question.
Yeah, I just love the bond that Eileen and Tracy have with each other. That's so great to see. You can tell there's an affection there. Molly has a question, a process question. Should we have our oncologist call for PT, or can I just call myself and make an appointment? Do you need a referral? How does that work? I'll start with Dr. Meister.
Sure. So the physicians can certainly provide a referral. In different states, the rules are different. So I might actually let Eileen answer that specifically for Kansas.
So at KU, we require a physician referral, and that is a very easy thing to obtain. Like you said, you would just message your oncologist or anyone on your physician team who would be appropriate, and just say, hey, I'm having XYZ symptoms. I think this could be helpful. Technically, Kansas does not require a referral, so different clinics will have different requirements. If you're not sure, I'd say either just go with your physician or call the clinic that you plan to go to and ask their protocols.
All right. Tracy, could you tell us what your life is like today as compared to before you received cancer treatment?
Yes. Hold on, I was getting disconnected.
So I was just asking if you could tell us.
Well, it was just, yeah, I kind of had said it earlier, but I just want everyone to make sure that they understand that, you know, your cancer rehab, it is a journey. And once you find your PT, your pelvic floor therapist, they will systematically be able to address all of your issues, whether it be the urinary incontinence or, you know, any type of sexual dysfunction, and, you know, having to see them after they, you know, see women after they have their babies. Pelvic floor therapy is like this special club that it's great to be a part of, because they just help the whole body. So I am so thankful to this day that I have found pelvic floor therapy.
So it's pretty clear that you are quite committed to coming on today's program and talking about this issue. Why do you think it's so important to talk about this and to really get this question out in the open?
I think that we need to stop thinking or making pelvic floor therapy a scary thing. You get very up and close and personal with pelvic therapy. I have sent a variety of friends to pelvic floor therapy, just because, you know, I know that at this point I'm not alone, and that after cancer, you know, chemo just doesn't. I'll go back a little bit. I did have breast cancer, but I did also suffer pelvic floor therapy, because, you know, chemo systematically goes through your entire body and just ruins everything. It damages everything, and it's up to you when you're done to try to build your body back together.
Well, thanks so much for being on today's program. And it sounds like from all of our questions that you're really having a big impact. And Alexis?
What a gift that she's willing to talk about this, because why is everyone keeping it a secret if sounds like there are so many women who have these issues clearly. I have one more question. This is from Nancy. Nancy wants to know, well, she says, my doctor never mentioned this as a possibility to me. Are all physical therapists trained in pelvic floor therapy, or do I need to find a physical therapist with that special credential? I'm guessing it's a specialized training and credential, but Eileen, tell us about your training.
So physical therapists as a general do not have pelvic health training. We have gone to many courses for potentially hundreds of hours of extra training in order to know how to do the internal assessment, how to analyze the muscles in a separate area of the body that is not part of traditional physical therapy. You can look online. pelvicrehab.com is a website that has pelvic health physical therapists listed if the person has chosen to put their name on that website. Otherwise, it does take looking online or talking to your provider. Most gynecologists, urogynecologists, urologists will have a team that they work with or PTs that they refer to that could be a good resource for you as well.
So Dr. Meister, what key takeaways would you like for our audience to remember from the discussion today?
Yeah, I'd like to echo what Tracy said. You know, pelvic floor disorders are common but often go unaddressed, and they don't have to. There are providers who specialize in these disorders, and we have a variety of ways to address them, both conservative treatment options like pelvic floor physical therapy, which we've talked a lot about today, but also there are some medications, and some women even benefit from surgery. So there is a variety of ways to address pelvic floor dysfunction, but it certainly does not need to go unaddressed or suffer in silence at all.
Mm-hmm. And Eileen, what would you like our viewers to remember from today's discussion?
Well, I think it's been clear that we are stating pelvic health physical therapy exists. That is one of the most common things I hear is people just saying, I didn't even know this existed. And then the second one that I hear regularly is, I wish I had known about this sooner, or I wish I had come in to see you sooner. So it is never too early or too late to come and get help. And again, it's not just physical therapy. I am a PT, but as Dr. Meister mentioned, you have more options. She and I work together regularly and refer back and forth and say, this has worked, this hasn't worked, what are our next steps for this patient? And again, just kind of that summary, we talk about all things pelvic. So bowel, bladder, pelvic pain, pain with intercourse, and anything else in the middle of your body, but kind of a head to toe assessment as well.
Thanks so much, Eileen. And Tracy, I think we would be remiss if we did not give you the last word today. We've broken a lot of ground on Bench to Bedside this morning, not only in terms of topic area, but also we've never had a patient coming to us live from a treatment room before, and that was a bit of a surprise even to me this morning. So appreciate your willingness, if indeed determination, to be on the show to talk about this issue. So could you give us your closing thoughts, please?
Yes. I just really want women and men out there to know that they're not alone, that there are physicians and therapists that can help you with rehabilitation after cancer. No part of cancer is easy. So allow people to help you along the way.
Well, we're very grateful.
You know, it is, yeah, and you know, you did mention that the fact that I am in the middle of an infusion. I thought that this was so important. It didn't matter where I was. I needed to be able to have my voice out there to be heard and to be able to help somebody.
Well, we appreciate your willingness to come on today's program to talk about this issue. And of course, we want to thank Dr. Meister and Eileen and you, Tracy. That's it for today. To learn more about today's discussion, visit kansashealthsystem.com and search pelvic floor. Join us next time for Bench to Bedside. Thanks for watching. Subscribe to our Bench to Bedside podcast, now everywhere podcasts are available.